माय मोगाचो येवकार. सगळे आमचे CCR TV पळयणाऱ्यांक welcome. We are on to the episode number 8. And we have this special program for all of you and all of us. Tumchi, Bolaiki, Tumche, Hatant. Your health in your hands. And the expert for all these episodes is our Goan, Asolna born, Goan famous Professor Dr. Wiseman Pinto. Dr. Wiseman, my mogacho येवकार.
Thank you.
Dr. आम्ही आज 8th episode, 8वो आसा. 7वो आम्ही पळय केल्ला, तो जावन आसा on cancer. आणि cancer is a major health concern across the world. In India, a large number of fatal cancer cases, they say that it is due to lack of awareness among general population and also late diagnosis of the disease. Fortunately, Goa is not amongst the top cancer states in India. In India, we have Uttar Pradesh, followed by Maharashtra, West Bengal, Bihar, and Tamil Nadu. And we have seen that cancer is and continues to be the leading health concern in India. It is estimated that every 9th person in India is likely to develop cancer at some point in their life. We talked about the general principles, how cancer is detected, how it should be, the lifestyles and all that. And today we shall concentrate on specific cases of cancer. You as the head of the pathology department in the Goa Medical College, I am sure you have had a varied and quite a rich experience in cancer cases in Goa. The number of cases is increasing. What is your...
Yes, Mr. Jovito, you are absolutely right that the number of cases is increasing. The reasons for this are many. Number one, better methods of diagnosis. Number two, the life expectancy is increasing. It was at the time of independence of India around 30 years. Now it has gone to 77. So people are living to old age. So cancer is a disease of the older people. Third, better methods of diagnosis, better knowledge of the subject, awareness among the people, and also different other risk factors are being identified. The viruses are also changing, the lifestyles are also changing. So that is why we are seeing it. It's not that cancer was not there.
It was
cancer
there.
Was there.
We
talked about it.
It.
But as I told you, in the last century, there were cases, but they may have not been detected or the knowledge was limited. Now the knowledge is tremendous. Every day, every hour, research, cutting edge research is going on in cancer, and that is why the cases are increasing. And they are being detected and treated. But our primary concern should be to prevent it or to get it early. As you rightly said, in India, about 10%, 1 in 9, as you said, are chances of getting cancer. As you said, the states, the latest cancer registry, they show Northeast.
Yes.
You know, there are a lot of people of Northeast all over India and Goa also. And Northeast has got a very high incident of cancer. Mizoram, Meghalaya, and Tripura, Arunachal Pradesh, you know, because of their lifestyle habits. Lifestyle habits.
Yes.
And also they have one virus called Epstein-Barr virus, like, you know, which is there in Chinese, Southeast Asia, which is also seen here. It causes certain types of cancer.
Okay. But they say that India is not among the leading countries all over the world, also because of their vegetarian
diet.
And they say that about 40 to 45% of Indians are vegetarians. And especially concerning red meat.
Red meat. Correct.
They are not very high,
Yeah.
but maybe this northeastern
Yeah,
states
yeah, yeah.
could
yeah.
be high
Could be.
on.
Because they eat a lot of pork.
Yes.
Pork also they eat, and they have this virus. Plus they smoke also. Smoking
Yes,
is also
smoking
common.
is
common.
definite.
Yeah.
Also drinking also.
Drinking
because,
is also common.
Alcohol is not
Yeah.
available there,
Yeah, yeah.
but hidden you can get
Yeah,
it. It's like in Gujarat.
Like Gujarat.
Yeah.
Now coming back to your, so the important causes is cigarette smoking,
Yes.
alcohol, and red meat.
Yes.
Now red meat. Now you'll be surprised in Gujarat. I went to Gujarat. I have gone many times.
You have gone
Many
all
times. Yeah.
over India
Yeah.
and 50 countries all over the world.
Yeah. So Gujarat has high colorectal cancer.
Is it?
Colorectal is usually eating red meat, fat. So I went into the details. It is because they are vegetarians. They eat vegetables, but because of insecticides and pesticides and microplastics in their soil, etc., that is the reason.
So the new reasons
New
are
reason.
now emerging.
Emerging,
like,
exactly.
Like we said also earlier,
Yeah.
that cigarette smoking
Is
is gone down,
but
pollution,
pollution,
the
yeah,
air that
yeah,
we breathe
yeah.
is no longer
The pure air.
Pure air.
As you rightly said, cigarette smoking of any type.
Yes.
Cigar, BD, cheroot, or even the pipes, as well as you said last time, e-cigarette. E-cigarette actually is like a vapor.
Yes.
Yeah, it gives you the feel, the stimulus, but the problem is you can get asthma and all these other. It is also carcinogenic.
And we talked about
Yeah.
active smoking.
Yeah, and
Also
passive. We talked of
about
passive smoking.
passive
Yeah.
smoking.
Now coming to that pan, we talked. In Gujarat, as pan masala pan. Pan has got a lot of ingredient.
Yes.
So they eat lot of pan. So oral cavity,
Oral cancer
cavity,
is,
and
on the rise.
pharynx, larynx. So
Yes.
that is on the rise with them. So this is some of the things which are relevant in Goa. Our relevance is breast cancer is very common.
Yeah, they say that
Yeah.
the top cancer cases in India,
Yeah.
lung cancer,
Yeah.
colorectal cancer,
Colorectal,
breast
breast,
cancer,
yeah.
pancreatic
Pancreatic
cancer now,
also, yeah.
and stomach cancer.
And of course, prostate you can't forget.
Yes, prostate
As you grow
also.
older.
Yes,
Yeah, yeah.
yeah. So we talked also about
Yeah.
the cancers in men and cancers
In women. I think we also talked about leukemia.
Yes, we talked about leukemia
yeah.
when we talked
Of
about
the saint,
our saint
Acutis.
Carlos
Carlos
Acuti,
Acuti.
and that was a very typical case that we could share with our viewers.
With the viewers.
Yes. Now, amongst women, breast cancer is on the rise.
Yeah.
And doctor, you have rightly said that this is a case of elderly people normally.
Correct.
Say 50, 60, and so on
Yeah.
and so forth. But of late,
Yeah.
we have been seeing breast cancer in young girls.
Young girls, correct.
So shall we
We'll
dwell,
discuss. We'll
mostly
discuss the breast
on,
cancer.
breast cancer.
Yeah. Now see, Mr. Jovito, before that, cervix cancer was the highest.
Yes.
And especially in villages, it's still there. But breast cancer today is very high.
Has overtaken.
Overtaken everywhere.
Yes.
Whether in the villages, whether in the cities. And breast cancer in India, the highest is in Hyderabad.
Okay.
Highest incidence. Second is Bangalore, metros. And Goa is also quite high. 30% people have breast
30%.
cancer.
It's
When I
quite
had done my
yes,
study.
Yes.
Now, breast cancer is something which is so easy to detect, so easy to diagnose. The breasts are organs which are easily accessible, seen, everything. So it is. Now, why do you get breast cancer? There are many reasons. The first reason is it is hormonal. So it is the cycles of the woman. The girl starts her periods, menarche, early and finishes it late. So a long reproductive life. That means estrogen is responsible for breast cancer.
Yeah, because only they have estrogen.
Yeah, they have estrogen.
Yes.
And nowadays, because of the type of diet, type of their habits, the girls start getting menarche. Menarche is the time when you start your cycle, first cycle period. They get early, 8 years, 9 years.
Because earlier it would be 12, 13,
12,
14.
14.
And
13.
now, as you have rightly said,
8,
at
9.
8 and 9.
Yeah.
And I was discussing this in Hyderabad when I was there with some doctors. And they said, probably the cause could be the milk that we are getting.
Right. It's all the diet, lifestyle, milk, the food, the lifestyles of these girls, everything put
Yes,
together.
yes.
And then the cycles continue till late. They usually menopause 45. Now it can go a little longer. So a woman who has a long reproductive life, more chances of getting breast cancer. Second, a woman who is not married, more chances. So the people who are not married,
Yeah, yeah.
who don't have children,
Yeah.
or who get the child late. Nowadays women get married late because of their the career, etc. Studies, career. There is a ambition. So this is one more thing. Who get married late, etc. So the whole family. If you have more children, there are less chances of getting breast cancer. If you give breast milk to the baby, less chances of having breast cancer. Nowadays, they have only one child or no children, and so these are some of the risk factors. Then these women in Goa and other places, they eat a lot of red meat, oil, fatty foods, which is also bad for breast cancer because it helps to make estrogen, produce estrogen. So these are some of the risk factors. And also there are many other risk factors which they could be exposed to, like all others. Whether some women smoke, you'll be surprised. In metros, there are many young girls who smoke. Coming from colleges and all. Because I go to Bombay as a visiting professor, and in my last visit, I see young girls. They stop near the like a gardo, and smoke.
This is the new trend
this is a
now.
new trend.
Yeah.
I go for
Girls.
a walk to the church, etc.
Yeah.
And I feel little bit, but this probably is going to the nightclubs, etc. It's a new trend. I
It
don't
is,
say
it
anything
is,
about
it is.
When I was in Portugal also, those women were smoking, and they told me, "Rock, you are lucky that you never started smoking." So they said it is so difficult to give up, and
No, in Europe,
yeah,
now
yeah,
more women, they say,
are
are
smoking.
smoking.
Yeah, absolutely
Whereas
right. Yeah.
men
Yeah,
are
so
giving
and
up.
Obesity
Yes.
is another factor, risk factor. Obesity, and we have to discuss obesity because it is a big problem.
Yes.
And besides obesity, sedentary lifestyles, and we don't know something called radiations. There may be background radiations in different places. Example, after the Chernobyl disaster, 1986, at Ukraine, which was that time a part of
Russia.
Today it is independent.
Yeah,
So there was a leakage. Many people got leukemia and breast cancer, thyroid cancer, etc. So the leak. Similarly, Nagasaki and Hiroshima in 1940, the World War II.
Yes.
That time also, many people, besides dying, the people who survived got breast cancer, thyroid cancer, leukemias over a spell of time. So this radiation, now we don't know, because many a times there are nuclear reactors, around Goa, etc. I don't say, but we never know. And background radiations, pollutions, even ultraviolet light.
Yes, your sun rays.
Sun rays
Yeah.
can give some skin cancers.
Yeah. In Australia, New Zealand,
absolutely.
I was told that
Yeah.
the schools
Yeah,
open much earlier than the sunrise.
because of the eyes.
And when there is a sunrise, they close the schools.
You're right.
And skin cancer,
Yeah.
it
It's
is
a
said
commonest.
that is the fastest growing cancer.
Mr. Jovito, you are absolutely right. This is seen in fair people.
Yes.
We are not that fair, most of us, compared to Australia,
Yes.
New Zealand. And second, because we are protected by the skin by the melanin.
Yes.
Second, they are exposed to this ultraviolet light and they get melanoma, basal cell carcinoma, which is very common there. In fact, in Lisbon, there are departments which see only skin,
Is it?
pathology, only skin. That means melanocytic lesions of the skin. And I told those colleagues of mine, I'm lucky I'm in India. We have got a dark skin. We don't see that often. It would be boring to see only skin whole life.
My God.
And so that is it's a...
They say that also in India, there is no or there is very little ozone depletion.
Correct. Depletion.
So
correct,
when the alpha or beta rays come,
ozone.
yes.
You are right. Absolutely. So it is. So this is some of the reasons why you get breast cancer.
Yeah.
I also told you that breast cancer, youngest patient I saw was 18, a young girl.
Is it?
Yeah, and her mother had died of breast cancer.
Okay. So all cancers, that's what we have seen.
Yeah.
If parents
Parents.
had been suffering, then you should take more
More
care,
precaution.
more
Absolutely
precaution.
right. If you have family history, especially
Yes.
on your mother's side,
Yes.
then you have to be very, very cautious. Start screening earlier age.
Yeah,
and be careful.
and
younger
we
age.
were told that the girls should do self screening.
Correct.
Though there are tests also.
Yeah. So, Mr. Jovito, you are very correct. The best screening for the breast is breast self-examination.
BSc.
BSc. Any lady, any girl, after her, actually they say in 20s, but after her first delivery, we don't, today the girls don't deliver at 20, but they from 20 onwards, they should see themselves in the mirror once a month after their cycle, after their period, because the breasts are not before that they engorged.
Yes.
So after the cycle, when the hormone, they have to examine the breast every month, till even after menopause.
Yes.
And it is very simple. See themselves in the mirror, their breast, and the right hand they have to palpate the left breast and see all over, including the armpit, all over, and see in the mirror if anything with the nipple is okay, areola is okay, and that there should be no lump, no skin changes, no color changes, nothing. So with the right hand the left breast, and with the left hand the right breast, and slowly it should be examined in front of the mirror or lying down, what the person is comfortable, and go back also into the axilla, and if they don't know, they can learn from the doctor.
Yes. Yes.
So that's called breast self-examination. That's the best examination.
And
And once a year they can go to the doctor.
Yes.
And sonography can be done later on.
Yes.
And mammography later on.
But in United States, I believe,
Yeah.
mammography is the most indicated.
Yeah. See, mammography has got its own problems. It compresses the breast. So many people get
Okay.
pain, etc. Number one. Number two, mammography also has little bit of rays.
Okay.
Rays.
X-rays.
Yeah,
So,
X-rays.
so all X-rays.
All X-rays
means
dangerous.
radiation.
I'm coming radiation. I'm
Yes.
coming to that. So there's a second thing. So sonography is good during the earlier. After you have menopause, you can do mammography. But some people do mammography once in 3 years,
Okay.
and sonography every year.
Yes.
So this is important if you have family history on your
Yes.
mother's side.
Now, we talk about sonography. We have also talked about mammography. Can this be done at the Goa Medical College?
Yes. Goa Medical College has got sonography
Yeah.
of the breast and also mammography. Machine is there.
The machines are
Machines
there.
are there, and they are good, and everything is
So
perfect.
you
And
have just to go there. And
you have to go there, radiology department.
Yes.
Dr. Sanjay Sardesai is our head of department. I don't know
Okay.
if you know him.
Yeah.
And he will, help.
So it can be done.
It can be done.
It can be done. And it is free of charge.
It's free of charge.
Okay.
You have to only make a case paper. Which
Case
call-
pa- yeah, that
case
is
paper.
that is
a-
separate.
Yeah.
So you have self-examination.
Self-examination.
That is once a month.
Yeah.
And then maybe once a year you do sonography.
Go to the doctor. Go to the
Yes.
doctor.
Yes.
Sonography.
Yes.
And then every 3 years you can do mammography.
Okay.
Yeah.
That's
So this is the things for the breast cancer. Now, if there's a family history, be very careful. Not only of the breast but also of the ovaries. There's a relation between breast cancer and the ovarian cancer. Ovarian cancer is in the abdomen.
Yes.
The two ovaries.
Yes.
So there is a relation. See, there are some genes which can cause both these. We'll be coming to genetic also later.
Yes. Yes.
Roughly about 10% of cancers are genetic. Yeah. So there's some genes called BRCA1, BRCA2. It has to be examined if there is a...
So this test also can be done at the Goa Medical College.
This test cannot be done, but the blood or the saliva can be collected, and it is sent there are many, and nowhere in Goa it is done.
No.
It is sent to places
Bombay.
outside Goa,
Okay,
Bombay or
okay.
Delhi or.
But then some of the private
laboratories, they outsource it.
They also can
Outsource it.
do this test.
Yeah.
So when we talk of breast self-examination,
Yeah.
then if you suspect anything, you do the sonography.
Yeah. Immediately go to the doctor. If your nipples are retracted or if there is some lump anywhere, go to the doctor. And doctor will see it, examine it, and will ask for a biopsy. It could be a needle biopsy or it could be a core biopsy.
Just absorption.
Yeah, absorption. That is
Yes.
which I was doing, needle
Yes,
biopsy.
yes.
And it can be done on a mammography directly if there is a lump, or a true cut biopsy, core biopsy, which is.
So if it is just at the beginning.
Yeah, it will be picked up.
Yes.
And then the surgery is very small. If it is cancer picked up, then it's just a local surgery. It's called a lumpectomy. You remove the tumor with the surrounding.
Yes.
And sometimes axillary clearance, depending on if node is involved. And then sometimes they may give you radiotherapy, may give or may not give, depending on the nodes and depending on various factors. Now, one more thing I'll tell you, Mr. Jovito, that the woman should not get scared. Out of 10 women who come with a breast lump, 9 will be benign.
Okay.
9 will be benign.
So that means there's nothing
yeah,
to be worried.
But do not rule out.
Yes.
You may be the 10th patient.
Yes.
That is the message.
Yeah.
That means most are fibroadenoma, fibrocystic disease, but the 10th patient, so you should have to be careful. And if you have family history, you should be more careful. So this is one thing. And many other doctors, we have different systems of medicine, like Ayurveda and homeopathy. I always advise them, if there's a breast lump, don't give your treatment. Just first do the biopsy. Then you give whatever you want.
Okay. So the biopsy,
that is the message.
The biopsy will
pinpoint. Will pinpoint and tell you, Baba, this is benign and this is cancer. This will change the life of the patient. If it is benign, you just take out a follow-up. You don't have to take out always. But if it is cancer, you have to operate.
Then you have to operate.
Otherwise, it will grow. So
there's nothing to be worried.
Nothing to be worried.
And if you are at the early stages, at the beginning,
no problem.
Absolutely no
You'll
problem
have a normal
at all.
life. You'll
Yes.
have a normal life.
Yes.
Follow up and all that.
Yes.
So this is the breast cancer. Histopathology. And there are some markers you do afterwards, like ER/PR, estrogen receptor, progesterone receptor, Herceptin. All these will give you how to treat the patient. Different markers. And now breast cancer is so many types of treatments are there, which will be, I think treatment also will discuss.
Yes.
Because surgery, radiotherapy, chemotherapy. Now there's a new treatment called immunotherapy. Which will come a little later.
Yes.
We'll talk about it.
We'll talk about the treatment.
So we'll finish this. So breast cancer.
Yes.
So how breast cancer presents? I told you the risk factors, all the risk factors. Now there may be a lump anywhere. It may be in the middle, it may be upper quadrant, middle quadrant, lower quadrant. And second, it is usually hard. Cancer is hard. Hard why? Because of fibrous tissue is hard. And then sometimes the nipple may be going, retracted. That's why I am telling you to see in the mirror.
The mirror.
May go in. Or the skin may have some, like a orange, peau d'orange. All this has to be carefully seen. And feel. Yeah. Sometimes you have irregularity, after periods, etc. That is called as fibroadenosis. It's not to be worried, but take care. Biopsy, show the doctor. And once you go to
biopsy
will settle.
Will rule out.
Will rule out everything.
Yes.
Yeah. Now coming back to these things, as I told you, if there's family history, be careful. Otherwise,
Yes.
we have seen so many breast cancers who are being treated. So many being treated. They live long life. And I get so many phone calls from patients that, sir, doctor, you had done my biopsy 20 years back, 25 years back. They phone me or send message, etc. So it is like that. Now, also one should be, so these are for breast cancer.
Yes.
Yeah, the clinical feature.
Yeah.
Also, you may have bilateral breast cancer. From one side, it may go to the other side.
Okay.
So you should be careful, etc.
But when you do the self-examination,
Yeah, you will see.
you will be able
Both. Yeah,
to
both.
see
the
both.
Both. You
Yeah.
have to do both.
Yes.
Yeah.
So then you talked about the second problem in women.
Women. I will go for ovarian cancer.
Ovarian
Yeah,
cancer.
because that is the second commonest.
Yes.
Ovarian. Now, cervix is also gone down.
Yes.
Ovarian is not gone, getting higher.
Is it?
Higher.
Is it?
Yeah, higher. So ovarian cancer you see around 40s, around 40 years old. Now ovarian cancer, what happens? Can be diagnosed by three things: ultrasound. You can see the ovaries, abdominal ultrasound, and there is one blood test called as CA-125. So that will also diagnose if it is high.
This test can be done at the
It is done in
Medical
GMC,
College.
Goa Medical College.
Right.
Besides CA-125, HE4 is also there, new marker.
Okay.
CA-125, HE4 can be done Goa Medical College, and ultrasound can be done Goa Medical College. So should do these two things.
Now, how often and what are the symptoms?
Right, it is a good question. So once you're 40s, then you have to do the ultrasound once in 2 years or once a year, and the blood test also once a year or once in 2 years. So
And how regularly?
if you have a family history,
Then
every 2 years. Otherwise, after 5 years you can do. If you don't have a
but
family
you start
history.
at 40.
Start at 40. That is my contention.
Yes.
Now, so ovarian cancer is silent. The patient may have pain, abdomen will become big, ascites, and so these are the symptoms. Usually is very asymptomatic, cold, no pain, nothing. And so patient come because of ascites and lump. So diagnosed by ultrasound, biopsy, and has to be operated. So that is unfortunate, and CA-125 and HE4. So what happens, unfortunately, ovarian cancer is a little difficult to treat because it's inside, and sometimes there's fluid, ascites, and there is metastasis. So sometimes difficult to treat. But there is good modalities of treatment. There's chemotherapy, anterior chemotherapy. Anterior means before the operation, chemotherapy, then surgery, then again chemotherapy. Of course, it is slightly difficult, but that it can be treated.
And chemo treatment is available.
Is available in Goa Medical
in Goa Medical College.
Free of cost.
Free of cost.
Free of cost.
Okay.
They are very costly drugs.
Yeah.
Free of cost, and new drugs come into the market. Here also there is immunotherapy, which we'll discuss later on. So, and radiotherapy sometimes. So this is the ovarian. Now ovarian is one which is increasing also, increasing.
What could be possibly the reasons?
Reasons are all these same. Genetic mutations, the life cycles, the food, the microplastics, and all these.
These microplastics are going to play hell. I think so.
Yeah.
But now recently they said there are microplastics in the salt.
In the salt, yes. See, once it is in the soil, it will be everywhere, in the water, soil.
Yes.
Because plastics is used like anything.
And more people now drink water from the plastic bottle.
Exactly.
I wonder sometimes all these players who play especially football and all that. So they take a plastic bottles and keep on drinking. Ultimately, there could be a possibility where microplastics.
Yeah, exactly. So it's advisable to drink from glass bottle.
Yeah. Originally, actually, people would take a bottle in glass. Or steel or copper.
Correct.
And I think so that was the best practice that we had.
You're right. That was the best practice.
Yes.
So these are some of the other reasons. Ovarian. Also, some women in younger age get this ovarian cancer, which are different.
But it will be rare.
I'll give you 2 examples.
Yes.
Because they are interesting. They are like germ cell tumors, endodermal sinus tumors or dysgerminoma, germ cell. And I'll give you 2 examples. One was a young lady. She came to, young girl, not lady, came to me. I had just joined 1984 and first year. And I diagnosed it as a alpha fetoprotein was not there that time, as endodermal sinus tumor. She was from Karwar, 1984 or 85. And it diagnosed was endodermal sinus tumor. It's a germ cell tumor of the ovary in this young girl. And Madam Elvira Dias was,
Yes, Elvira,
you must be knowing her.
famous
Must be knowing. She was the head of-
gynecologist.
So she advised, she was related to my technician. So she advised the patient, she was unmarried, young girl, that showed her some papers that we will save the uterus and we'll take only the ovaries. But she said, no, take out everything. I want a complete cure. Everything was taken out. So she doesn't have children. Now I'll tell you.
Yeah.
Last year, my technician is retired, came to visit me for his some work. So some patient.
Yeah.
So I said, Are, how's your patient from Karwar? He said, Doctor, she's fine. From 84 till today, she didn't marry. She got a lot of proposals, but she did not marry because uterus,
Yeah,
everything was
yeah,
removed,
yeah.
and she's alive and she's fine. Just giving an example. Same time, I'll give you another example after another 10 years in pathology. Another patient from Vasco, young girl, brought to me by a doctor, very prominent doctor of Vasco, saying, Are, this is my son's neighbor, friend, etc. Again, germ cell tumor of the ovary, and done in 2 parts. The tumor is cut into 2 parts. One is sent to Bombay, to Tata Memorial, one given to me. Mine is malignant, germ cell tumor. Other one is only showing benign.
Is it?
Yeah, because unfortunately that doctor got the wrong means the one which is benign. I got the right one which is malignant. And young girl again, 20s. So now again done, operated. The doctor said, I never knew that you should not cut into half. And I said you should never cut. Give one piece to one person, blocks you can send. Then I met the doctor last year. So that means after 30 years, she said the girl has got married. Her uterus was saved in this girl.
Okay.
Girl got married, she is saved, and she has got children,
Is
etc.
it? Is
etc.
it?
So this is the second story.
Yes.
Third story of this ovarian cancer. I was sitting in my chamber. I was reporting during lunch break. Last year this is, before I retired. And during lunch break. And my room is air conditioned. I just came out. And I saw small children, boy and a girl, playing, well dressed and running. I said, what happened to you all? What happened? No, my mother. The mother came. She said, Doctor, I am the daughter of your clerk. I had a clerk and you had diagnosed me as dysgerminoma. When she was 20 years old, it was operated and she is now having children. She is in Gulf. And she had said, so it is, I came to know the follow-up by chance because I walked into the corridor and saw this girl and boy. So just to tell you, this is not only treatment of cancer, there is like a family, whether to remove the uterus, not remove the uterus, ovaries, because it's a whole life. And I have given you 3 examples. One of one patient, and she was doing paratrooping, who said, no, I don't want anything, and removed.
Must be fear factor.
Yeah, fear factor.
Yeah.
Second, and Madam Dias had shown her articles that my technician told me.
Yeah.
My technician is a very smart fellow. He told me, sir, that she showed her, but she didn't want. Number 2, showed a publication. Number 2 is from Vasco, and number 3 is my clerk, daughter. Clerk was long back. She must have retired now. And her daughter from somewhere in Tiswadi. Also, I was very happy to see all these cases.
Yeah.
And I came to know only last year because I don't follow them all up. But if I meet somebody, I will surely be asked.
Then you know.
I will be asked. So just to tell you, these are younger ovarian cancers.
Yes.
And these respond very well to treatment, chemotherapy.
So
As I told you, that AML is very good treatment, acute myeloid, which for M3, our saint Cutis.
Yeah, Carlos
Cutis. What he got, treatment is there now. Similarly, for germ cell tumor, non-seminoma treatment is there. Our teacher in pharmacology, my teacher, was Dr. G.J.S. Abraham. He was the dean of
the Goa Medical College.
And he was professor of pharmacology.
Yeah.
I remember him teaching when I was in second MBBS, that cancer, 2 cancers, there is treatment. He said, choriocarcinoma, there is treatment, And there is for germ cell tumors, there is treatment, and acute leukemia, there is lymphatic leukemia. So I remember his words, and I saw the the path of medicine. It is absolutely true. It must have just come that time.
Yes.
Yeah. So I've told you the ovaries.
Yeah. Earlier, when we heard about cancer, earlier,
Mm.
people would say Tata Memorial
Yeah, Tata, yeah.
in Mumbai.
Mumbai.
But today I don't think so.
No. Now I'll tell you, Jovito Mr. Jovito, we are going to discuss this also. You know, when I trained in Tata in 1987, that time my colleagues used to tell me that P.B. Desai was the director of Tata. Dr. P.B. Desai, very good surgeon, trained under Dr. Anas Borges, very good in everything, whether in teaching, whether in surgery, whether in administration. Such people are very rare.
Rare.
Administration, with respect. He said if there are 25 P.B. Desais in India, India's cancer will be very good.
Is it?
Yeah, but today there are 23 Tata hospitals done by Tata Trust and Ratan Tata. There are 23 in different parts of India. Tata Trust, they are called Tata Centers. And they have post-graduation, super specialization, which is called DM in oncopathology. It was started during COVID. I was called to inspect as an inspector for this DM, Tata Hospital. And they are very good. Very good. I have seen the one in Varanasi, 500 bedded. It is very good. The surgeons are very good. Pathologists are very good. It is as good. And there are like 23 all over India. Similarly, there are 23 AIMS all over India. So this medicine should not be concentrated. You go to Tata, it is packed with people. Even today, 1987, it was packed. Today also it is packed. Patients sleep on the pavements.
Is it?
Yes, or on the staircases when I go for the conference. Even now, when I went few months back, I gave a lecture in Tata Hospital as a visiting professor. People are asleep on the... It is sad, they come from all over. They come from all over India, Bangladesh, Nepal, Pakistan, of course, now they don't come, but they used to come. So, Bhutan. So, it is, it is a real referral hospital.
But at one time,
Yeah.
Dr. Wiseman,
Yeah,
people from Goa
yeah,
would necessarily say,
Yeah.
if it is cancer,
yeah. Rush.
I will go to
Yeah.
Tata's
Yeah.
and then I will see what is to
You're
be
right.
done. Is the same now?
It is more or less the same now, but it will change. What they do, they go now to Tata, take the protocol, get the full protocol, what treatment should be given, come back and take the treatment in Goa.
But Goa is now going to have a dedicated...
Now Goa is going to have a dedicated cancer hospital like the Tata is in 23 places.
yes.
And there will be a tie-up with
Tatas.
Memorial Hospital. By the way, they have given, some nurses have been sent from Goa Medical College for training to Tata Memorial
Is it?
Hospital. Yes. They told me
Yeah.
when I went there. Number one. Number two, Dr. Anita Borges, who passed away about
Now.
a few days back.
Yeah.
And her family is for the 100 years of her father, Dr. Anas Borges, they donated a scholarship in Goa for 7 lakh rupees, so 40,000 is per year for a Goan student to go and get trained in Tata Memorial. So that is another aspect. And there is now with e-medicine, telemedicine, you can see consultation with anybody, anywhere. Even slides can be seen anywhere, with telepathology, telemedicine. So that's another thing. And the medicine, this cancer chemotherapy keeps on changing and changing and changing. So the moral of the story is cancer should be treated close to your house, not far away. Not far away. Because
Why?
Yeah, because there is a lot of emotional, social, you're weak, tickets for travel, how to travel, etc. So here at home you're more comfortable. When we discuss palliative, I'll be telling you in detail in the next session.
Yeah.
So and now it is occurring, it is getting decentralized.
Also of late, people will go to KLE.
Yeah. See what happens, there are some issues like the radiotherapies, better machines have come in KLE or in Belgaum, Manipal, Donapal as Manipal. So radiotherapy is also a very targeted therapy, targeted radiotherapy. So these are some of the issues. That is why they are going. But I'm sure that when this machine comes, and now it's getting advanced and advanced and advanced, radiotherapy, proton therapy.
So things will change.
Things will change.
Will improve.
Yeah. Now again, let me tell you, the richest people of Goa or of India, they don't go to Tata. They go to Memorial Sloan Kettering in New York.
In New York.
New York. And MD Anderson. Now, I organize conferences. I'm getting those doctors for my conference in Goa. MD Anderson I've got many times. I'm getting from Memorial Sloan Kettering for my conference, which is in Goa on January in pathology. So these people go there, including politicians, industrialists, businessmen.
Those who have got big
those
money.
are actors.
Yeah.
The problem is they have to arrange stay there.
Okay.
The family has to look after.
Okay.
Nutrition is there, food is there. So all this I'm trying to tell you. So it is like this. The world gets better and better. But it has to be decentralized also. So I've told you about now ovarian. I've told you breast. Cervix cancer, let us go to female.
Yes.
Cervix cancer can be prevented. It is one of the cancers which can be prevented also, like breast, very easily.
Yes.
By doing PAPS test, pap smear, and a vaccine called HPV vaccine.
So I think that is the only one vaccine.
Only one vaccine.
Yes.
Human research vaccine I'll tell you later. In
Yeah.
animals,
Yeah.
some super
Yeah.
vaccines are come. That
Yes.
I'll tell you
Yes.
for the next session. So in women, cervix cancer, if you give this vaccine called HPV vaccine, human papilloma virus vaccine, it is given to the girls at around 10, 11, 12. It prevents cancer of the cervix, because HPV is the cause of cervical cancer. Now causes, and then I'll tell you about the vaccine after that. So cervical cancer is seen in women, again deadly, silent, and kills the patient. So patient has discharge, bleeding, patient has pain, all these things. And these type of patients of cervical cancer usually have many children, as opposed to the breast. They are promiscuous, many partners, because sexually transmitted diseases, and like this. So, but cervical cancer can be prevented by two things. Pap smear, named after George Papanicolaou. George Papanicolaou is world famous person. He was born, he's a Greek, but he went to America. War was there. So many people went to America, and he is a doctor, and he did research on and did a pap smear with his wife, Mary Papanicolaou. I did an oration on George Papanicolaou last week in Jaipur. They invited me. So George Papanicolaou designed this pap test, which by examining the cells, exfoliated cells from the cervix, the patient can be diagnosed whether having cancer or dysplasia before cancer, CIN1, CIN2, pre-cancerous stage, which is a landmark discovery. Now, vaccine was discovered later on, HPV vaccine. Now, George Papanicolaou is a landmark discovery. 1927 he did, and his wife helped him. Wife was like his own. They signed a prenuptial agreement not to have children.
Is it?
Yeah, so that he can concentrate on his research.
Yeah.
And then after that, he got the he diagnosed this. Now HPV is a virus which causes the cancer of the cervix. But HPV can also cause certain oral cancers, head neck cancers, and other cancers. So that is why this vaccine. When I went for a conference in US, there was a lady, she's the topmost in the world, from John Hopkins, who always presents in my sessions HPV in head neck, not in cervix, head neck cancer. And she showed a young girl, black, African, who had cancer, nasopharyngeal cancer, and HPV positive. HPV was positive. So I told her, she was around 20, that girl. So I told her, see, if this girl had been given the vaccine, HPV vaccine, it would have prevented this and cervical also. Said you are right, absolutely right.
So is this vaccine available in
Yeah,
India?
this vaccine is a bit costly.
Okay.
It's $100 per dose, 3 doses. So $100 is about 8,000 rupees. So for a common man it is costly.
But is it
It is available
in Goa?
in metros in Goa.
Okay.
They have no. It's not given free of cost. You have to order it.
Yes.
And in metro cities, the richer people, they take it. They take. In fact, I gave an oration in Bombay, and so that lady tells me, when they come to me for their wedding invitation, the Dr. Usha Sarai, who's a topmost, very 86, 87 years old gynecologist and pathologist, my friend, and of course she's much senior to me, and she said every time the girls come with their invitation, I tell them, take HPV vaccine.
Is it?
Yeah, she tells. She tells them. So HPV vaccine prevents against, and Pap smear prevents against.
So I think this is the only one vaccine.
Only one vaccine.
Only one vaccine.
There are more going to come, which
Yeah.
I'll tell you later.
Yeah.
They're in the trial stages. They're
Yeah.
in the
So I think we need to continue.
Yeah.
Because we could not dwell with all types,
Of
and
cancer.
we are not going into men's.
Yeah. So we have finished now.
So
Breast, cervix,
yeah.
and ovary.
Yeah, so for women, and I think it's time for us to call it a day.
Yeah.
And we shall continue.
Continue.
Because there are so many
Yeah.
others.
Men's
And
cancer and other issues.
Yeah,
also.
we will. And because cancer ultimately is not one disease. Yeah, but they say over 200 and different diseases.
Correct.
With a wide variety of
Correct.
causes and behavior.
True.
And as you said, there is hope for better treatments
Yeah.
and cures
Yeah.
for many specific types of cancer through advances in areas like immunotherapy,
Correct.
targeted therapy,
Targeted therapy,
and
correct.
early detection.
Early detection.
Thank you so much,
Yeah.
Dr. Wiseman. We'll come back.
Deu
and,
Borengoro.
Deu Borengoro.
Obrigado. And thank you.
Bye bye, doctor.
Bye-bye.